Hi everyone, I'm Swasti and today we'll talk about a very interesting topic, that is lateral epicondylitis and medial epicondylitis, commonly known as golfer's elbow or tennis elbow. So, what is lateral epicondylitis? There is pain, tenderness and inflammation at the common extensor origin of the forearm. So, the common extensor origin is affected. This is my common extensor origin. There is pain, inflammation and tenderness at the site, which progresses to the entire forearm when the disease progresses when we talk about lateral epicondylitis. So when we talk about medial epicondylitis, there is pain, inflammation and tenderness as well, but at the medial epicondyle. So flexure origin is affected. So this disease occurs due to overuse syndrome. So it is also known as overuse syndrome. When you overuse these muscles, this disease may occur. Okay, now we talk about etiology of this disease. What are the etiology of the disease? So etiology, when we talk about etiology first being inflammation, second being degenerative changes, third being microscopic tear, fourth being some hypovascularity. Okay, these are the four etiology that may lead to lateral or medial epicondylitis. So moving forward, when we talk about treatment, we come across lot of treatment protocol when we talk about physiotherapy. So talking about treatment, we will discuss about various physiotherapy treatment that one can give. First being, you can provide the patient with modification of activity. You will tell the patient what all modification of activity one can do as to reduce the pain, as it is overuse syndrome. Second being, you can provide the patient to reduce the pain. As to reduce the pain, you can provide the patient the various modalities, the therapeutic modalities that we have, that is TENS and US. Third being, you can provide the patient with splint and braces, which will help in reducing of movement and as to reduce the pain. Okay, now fourth being, you can help the patient by taping the joint, by taping in a direction, that is you will use rigid taping that will reduce the pain. Okay, now fifth being very important, that is exercises. You can help the patient by telling different exercises, which we'll discuss later, what all exercises one should do when suffering from lateral epicondylitis. One thing you should keep in mind, you can also give icing to the patient when suffering, when the condition is very acute. You can provide icing to the patient at the site of the pain. Okay, now moving forward, what all test one should do when suffering from lateral epicondylitis. So one can perform various tests for testing lateral epicondylitis, for diagnosing lateral epicondylitis. One being Mills test, second being Cosin test, third being Chairs test and various other tests. Okay, now moving forward, talking about treatment of all the exercises. As we talked about the treatment, we'll talk about the exercises. All the biceps curls are important, all the eccentric exercises are important. One can do ball squeezes, one can do hammer curls, one can do biceps curls, one can do drawing the sword movement, etc. are important. One should perform when suffering from lateral epicondylitis or golfer's epicondylitis, depending upon the individual. So that was all for today. Thank you so much for watching. Keep watching and please like, subscribe and share. Thank you so much.